All right, everyone, we are live. Good morning from the Disability Justice Network of Ontario. We are here based in Hamilton, Ontario, because Hamilton has the largest density of disabled people in the province. And like many people across the province of Ontario, disabled people are very alarmed at the mandates for masks being rolled back and the fact that on the 21st, masks will no longer be required in schools, restaurants, bars, gyms, and movie theaters across the province. We're also worried that on the 14th, mandatory vaccination policies for employees at schools, childcare settings, hospitals, and long-term care homes will also come to an end. The Disability Justice Network of Ontario is joined this morning with a number of organizations from across the province calling for an end to the repeal of these important mandates that are put in place to protect all of us. We're joined by Eco Hussein, an environmental and disaster management organization founded by women of color and people with disabilities in Ontario, and they're also part of the GTA Disability Coalition. We're also joined this morning by Doctors for Justice in Long-Term Care. We're also joined by the ODSP Action Coalition, Horizon Ottawa, the Criminalization Education Project up in Ottawa as well. We're here today to talk about the fact that these repeals of these important reforms will kill people. Surge cases and hospitalizations will continue to increase, which will further postpone surgeries and care that many disabled people need, and cause lockdowns in institutions once again, which led to the death and will continue to lead to the death of many people living in long-term care. Disabled people will be forced to remain fully isolated and not be able to access services required for daily life. Disabled kids and students are going to be abandoned and isolated for fear of missing out on school, and then also face the risk of being sick or transmitting diseases to their friends and family. The fact of the matter is, our government has decided to put in place policies that allow the death of disabled people rather than supporting our ability to live. We saw this in every level of government, where federally disabled people were left out of emergency response benefits. And now we're also seeing that the Ford government has decided to move forward with the privatization of very important healthcare services, while also saying that we should be returning to normal. What this means is that while everyone else who might not face risks to the same degree as disabled people can go out and live freely, disabled people will continue to die en masse in this province and be left behind. The truth of the matter is, disability affects every race, religion, geographic location. Any one person can be disabled. It is not that difficult to be a part of this community, and if you haven't been part of this community, you will be one day. So continuing to create legislative policies that say disabled people are not equal citizens, that we should be left behind, that we're in a pandemic and students should be forced to be in anxiety-induced situations where they can either be killed or kill their teachers and their friends, it is ridiculous. And so we're here today as a coalition of disability-run organizations, our friends and our allies, to say that the mask mandates have to be put in place, that the vaccine policies need to be put in place and stay in place until we can actually ensure that everyone in our province will be safe and equal and treated as such. The first person that we're going to have joining us today to speak will be Asia Hussein, from the Eco Hussein organization. Go ahead, Asia.
Bonjour, Annie. Asia and Dishnakas. And Don Jabata Kranto. Minwa Ecohesion. Hello, everyone. Welcome. My name is Asia Hussein. I took a deep breath because not only am I a professional in these intersections, I am of the most highest at risk. I am one of the people, many, 1 in 2 people across Canada are at high risk of COVID-19, very poor, horrible outcomes. Some of the 1 in 2, many actually, are going to face horrific death, while, like me, are relegated to solitary confinement, apartheid from the rest of our loved ones and shared society. And so I think it's important to share that our world is losing not just people we love and who are worthy, but we are losing so much expertise and wisdom and innovation to helping us move towards a just recovery of this pandemic. As you heard, I also do disaster management. And disaster management is a cycle in which, to be effective, it needs to be swift and proactively in prevention to mitigate when a disaster strikes, in order to be able to respond in a cohesive way to not leave anyone at the most risk behind for a just recovery. The essence of managing and mitigating disasters is to reduce disaster risk. And disaster risk is calculated by looking at vulnerability times a hazard, and that equals your disaster risk. And this is why persons with disabilities, disabled, immunocompromised, people with chronic illness, seniors, children and infants who are not yet immunized are placed at the highest risk. And someone like me who is on a lung machine 18 hours a day, who already has significant disabilities, an exposure for me and many others would be guaranteed death, and also with immune conditions that that are the essence of what it means to go into a cytokine storm. My actual cells in my body and my rare conditions are what have guided safety for all of us in this pandemic, including treatment, to stabilize our cells when they go into a cytokine storm, to prevent and mitigate and heal from COVID and long COVID, in how to be safe in our disaster management measures. And so here now I'm going to move on to measures. One thing that's really important when we think about public health is, first of all, it's public and it's health. In managing disasters, they cannot be placed on the individual alone. There needs to be some regulation and legislation, and there needs to be incentives in messaging that is also easier for people to understand, and to understand that these are not restrictions and mandates. They are protecting us. We are protecting each other. We are making sure that we are not being complicit in genocide and apartheid of the most vulnerable at risk in our society, who you will become one day. And I'd like to just pass the mic on and be able to hear from the wisdom of our co-panelists.
In Ontario.
So thank you, everyone, for inviting us to this press conference this morning. My name is Dr. Andrea. I'm a palliative care physician who has worked on the front lines of the COVID-19 crisis in long-term care facilities and in home care. Many of us already know about the humanitarian catastrophe that has occurred in Ontario's long-term care facilities during this pandemic, where over 4,500 people have died of COVID-19. Countless others, we don't even know, died in neglectful and inhumane conditions, some even without access to food or water or basic hygiene. And yet the Ontario government's delayed and neglectful actions in this latest waves led to over 450 deaths during the Omicron wave, and thousands of staff were actually off sick, worsening the neglect in long-term care. Thankfully, there was a vaccine mandate in long-term care. N95 masks were provided and rapid testing was increased. Otherwise, the suffering and death undoubtedly would have been much worse. Sadly, during the Omicron wave, home care had no vaccine mandate, no N95 masks provided to health workers, and no access to rapid tests. And as a result, I actually looked after people who were receiving home care who were suffering greatly without actually any care at all because so many staff were off sick. I actually cared for people who died alone, without any nursing or PSW support and without basic equipment such as a hospital bed provided. In spite of the tragedy of this Omicron wave, which has actually not even ended yet, we had an announcement from our government and from public health yesterday, which was counter to the science and was honestly a complete betrayal of all those who have suffered and worked so hard to save lives during this pandemic. It was basically saying to frail elders, people with disabilities, and immunocompromised people, you're on your own. Firstly, the end of mask mandates is not tied to objective indicators. Masks were introduced when we had about 180 cases in this province and test positivity was 0.8%. Now we are removing masks when it is estimated that we have 12,000 cases and test positivity is 11.2%. We have runaway community transmission at this point in time. So what is the rationale to remove masks right now? Why is the government so eager to remove one of the most impactful, least disruptive, and one of the most cheapest tools we actually have to protect us during a deadly pandemic? Why are we not educating the public about airborne transmission and procuring N95 masks for everyone? Why are we downloading the responsibility of the pandemic onto individuals rather than ensure mask wearing at a population level to avoid another catastrophe? Why are we not educating people about the risks of long COVID? And for those who are suffering from long COVID, providing them appropriate treatment and support? Why are we abandoning all health protections with another variant? When we have a highly contagious variant actually on the horizon now, which is BA2, taking hold in Ontario. BA2 is actually 30% more contagious than Omicron, which was already very contagious. This is not learning to live with COVID. This is actually surrendering. It is actually surrendering to COVID. This is profoundly ableist and saying to everyone, you're on your own. We're not going to provide you accurate knowledge. We're not going to provide you the resources, and we're not going to provide you all the tools that you need to even survive. At Doctors for Justice in Long-Term Care, we stand with the Disability Justice Network of Ontario and with everyone who is part of this press conference today and with all organizations in solidarity against the profoundly ableist actions of this government. We call upon the government to immediately reverse course, reinstitute the mask mandate, procure free N95 masks for everyone, and urgently prioritize N95 masks for those who are more susceptible to COVID. We're calling for a reinstitution of the vaccine mandate in long-term care with a plan to upgrade to third doses. And in fact, we should be having a vaccine mandate for all of healthcare. We need to improve ventilation by providing HEPA filters and monitoring air quality. We must expand PCR testing and legislate 10 paid sick days for all health workers and all essential workers. We have to repeal Bill 124 and urgently hire and train more health workers. We need a long-term plan to keep people safe during this pandemic, which is far from over. We are demanding justice.
Next up, we have Andrea Hattala from the ODSP Action Coalition, which is an advocacy group of ODSP clients and allies, not government affiliated. They prioritize defending the dignity of folks on social assistance by advocating, educating, and demonstrating the need for reforms to social assistance in Ontario.
Hi everybody. I would just like to reiterate what Dr. Amit said before, and just say that COVID is real. There were a lot of people that disbelieved the mask mandates and thought that they shouldn't be in place, but they ended up being a real problem. And millions of people have died, and there's still mandates going on. They were put in place to stop the spread of infectious symptoms. And the symptoms are varied, and even though they are not severe all the time, you can still infect others. So this is the reason why we still need mask mandates. And there are many clients of ODSP that are immunocompromised because of disease, because of the diseases that they have or the medications that they are on. They have had to be extra careful during this pandemic. The disease has not subsided, and their fear has not subsided. So lifting of the mask mandates means that there will be more infections and more fears. And it would be so much better if the mask mandates stay around till the cases become lower, like for another few weeks, not just a couple. Thanks.
Thank you so much, Andrea. Next up, we have Sam Hirsch, who is co-founder of Horizon Ottawa. Horizon Ottawa envisions a future where the municipal government protects the environment, expands public ownership of infrastructure, and creates public spaces that are safe, inclusive, and accepting of all its residents. Horizon Ottawa envisions municipal government that is committed to dismantling all forms of repression, including inequity based on gender, race, religion, sexuality, ability, and economic circumstance, while supporting true and meaningful reconciliation with Indigenous peoples.
Hi there. Thanks for that introduction, Sarah. Can folks hear me?
Yes.
Good. Okay, great. So before I begin, my name is, I want to acknowledge that I'm on the unceded and unsurrendered territory of the Algonquin people who have lived here since time immemorial and continue to inhabit these lands despite centuries of oppression, hardship, and land theft. And when we speak about COVID-19, we must recognize the disproportionate effect this deadly virus has had on Indigenous communities, among others, across this country, like many diseases have historically had. My name is Sam Hirsch, as Sarah noted, and I'm a board member of Horizon Ottawa, a local grassroots organization in Ottawa comprised of over 600 members across the city that advocate for progressive issues at the municipal level alongside different social in our city. I want to first thank the Disability Justice Network of Ontario for inviting me to this virtual press conference to speak here today, and thank all that spoke so powerfully before me. When I heard their voices and their words and the words of many of our own members, I hear the deep feelings of betrayal and abandonment from our provincial government, who has decided to throw the burden of the spread of this deadly virus completely on individual residents of Ontario, while we all know that the real reason we continue to be stuck in this endless pandemic loop is because of the failure of governments who have bent over backwards to prioritize the economic profits of businesses and corporations over human life. As some have said before, the science is clear and the numbers, however opaque they are because of lack of testing, are clear that the lifting of these restrictions is too soon. Even Peter Juni, the head of the Premier's own COVID-19 science table, agrees. This was a decision many of us expected from this government, but not this soon. It's clear that this move to end mask mandates and lifting other measures was a political gimmick by a Premier who was even too cowardly to make the announcement himself. Those of us here today and people across Ontario did not sign up to be pawns in this Premier's bid for re-election. What we want is to be safe and for the lives of disabled and immunocompromised folks all across this province to matter enough to simply be taken into consideration. The lifting of this mask mandate and other important measures at this point in time will worsen spread. It will likely overflow our hospitals and die, and the Premier and Dr. Moore know this. Even yesterday, during the doctor's press conference, when asked if he would still wear a mask in a grocery store, he said yes, because there would be a lot of risk. Why is he not willing to put his own life at risk, but is willing to put the lives of 15 million Ontarians on the line. We must prevent needless deaths and mass debilitation caused by COVID infection, including but not limited to significant neurological deficits, increased risk of stroke, and long COVID. More than 750 people have died from this virus in Ottawa, and more than 2,200 have been hospitalized. The strain on hospitals, healthcare workers, and patients is unsustainable and dangerous. Knowing that infections have rebounded every time restrictions were lifted, it makes little sense from a public health perspective to eliminate protections from a debilitating and deadly airborne pandemic. We introduced face masks, the provincial government rather introduced face masks in spring of 2020 when cases were at 150 cases per day, but are now ending the masking requirements when we are reported close to 2,000 cases per day, and probably more because of testing so limited. It just doesn't make any sense. To truly free ourselves from this endless loop, we need an approach based off one that prioritizes the dignity, well-being, and safety of everyone, not just economic profit. To that end, Horizon Ottawa and I'm sure the groups here as well are demanding for measures that create real safety and security, such as increased access to testing, PCR tests and rapid tests, proper access to vaccinations, upgraded vaccine passports, ventilation upgrades, a real plan to solve the healthcare staffing crisis, increased hospital capacity, and 10 paid sick days for all workers who contract COVID-19, and other supports like income support and rent relief. Finally, failing any action from the Premier and his government, we are calling on local chief medical officers of health and public health units to act where the provincial government has failed. Medical officers have powers under Section 22 of the Ontario Health Protection and Promotion Act to, quote, require a person to take or to refrain from taking any action in respect of a communicable disease, including mask wearing, imposing capacity limits on certain businesses. Many use the Section 22 order at the beginning of this pandemic, and there is no reason they cannot or should not have the courage to use it now. I saw news just this morning that the top doctor in Niagara region was thinking about implementing a Section 22 order. So there's no reason the local health authorities cannot act and show courage and stand up to this Ford government. We are asking them to not capitulate to Ford, do what's right where the provincial government has failed. Governments must use every tool they can to keep residents safe. Anything less is negligent. Thank you.
Thank you so much, Sam. Next up, our last speaker is Justin Piche from the Criminalization Punishment Education Project in Ottawa. Professor Piche is a member of this organization, which runs the Jail Accountability and Information Line that works in solidarity with people held at the Ottawa Carleton Detention Center, many who have disabilities, in order to address the human rights issues they face. He's also an associate professor at the Department of Criminology at the University of Ottawa.
Thank you. And as was just mentioned, my name is Justin Piche, member of the Criminalization Punishment Education Project and a professor of criminology at the University of Ottawa, located on unceded and unsurrendered Algonquin Anishinaabe territory. And I've been studying the impact of COVID-19 on jails with the Prison Pandemic Partnership for almost 2 years now. I must say that I was really alarmed to hear yesterday that the mask mandates will be coming to an end in schools as a parent following March break. And I was also alarmed to hear that by the end of April, that those mask mandates are going to be coming to an end in congregate care settings like prisons. This decision seems to be very dangerous and it needs to be reversed. During a 3-month period from December 1st to February 28th, there were at least 3,393 newly reported COVID-19 cases linked to provincial jails in Ontario. 2,580 prisoners, at least 813 staff members. And that accounts for over 56% of the total 6,000 plus cases that have been connected to these congregate settings of human caging by the end of last month, since the start of the pandemic. And during the first week of this month, at least 97 people imprisoned in Ontario's jails have contracted COVID-19. And it's clear that congregate settings remain significant vectors of COVID-19, and that we're still in a prison pandemic. We're still in a pandemic, and people are dying. For instance, we know that so far in 2022, right, which is now just getting into its third month, at least 4 people have died at the Maplehurst Correctional Complex in Milton alone. And according to callers to the Toronto Prisoners' Rights Project's jail hotline, at least 3 of those deaths were from COVID. And it's also important to understand that nothing that happens behind bars or within congregate settings stays there. People, most notably workers, exit these institutions day in, day out, and they return home to their families in our communities. And as long as congregate settings such as jails continue to have outbreaks, COVID-19 is going to pose a broader threat to public health. So, if you want to set that aside, if the government and the public does not care about the public health implications of COVID-19 transmission behind bars, they should care about the community safety implications when outbreaks occur. When there are new COVID-19 cases detected amongst imprisoned people and prison staff, institutions are locked down, which means something totally different inside jails than it does out here. And visitors and community volunteers are locked out. In the first week of March, 13 out of 25 provincial jails had active COVID-19 cases in them, which means those institutions are on partial or full lockdown. And when this happens, already scarce programs are canceled, scarce health and mental health services become even more limited. Solitary confinement, which we used to talk a lot about before the pandemic, those kinds of conditions are imposed for weeks or months on end in the name of infection control. And we know the results are devastating. Prisoners' physical and mental health deteriorates, tensions escalate, and we call this public safety. And most people are eventually exiting prisons. There's no evidence to suggest that this is a good idea. So just to say, returning back to the mask mandates, masking isn't a panacea, but it is a simple and concrete measure proven to help reduce transmission. And we know that this is a step that the Ministry of the Solicitor General has all too often failed to take, according to imprisoned people who have reported not having consistent access to masks throughout the pandemic. Can you imagine that? So if we're going to compound this by no longer mandating masks in congregate settings, we're just going to increase the risk that imprisoned people face, including people living with disabilities in jails. And we're going to be unnecessarily exposing them to illness, hospitalization, and death. And for what? So that we can see each other smile? Is that what we're talking about here? I'd rather have a mask over people's smiles than have to shed more tears for all the destruction that this policy, wrong-headed policy, is going to cause. So as governments ease COVID-19 measures, it's really critical that they don't lose sight of the plight of human beings who have been pushed to the margins of society, who are confined in congregate settings. Authorities have to do what they can to contain COVID, not people, and masking helps prevent COVID-19 transmission. It helps prevent lockdowns within and beyond congregate settings, and masks ought to continue. Mask mandates ought to continue until such time that the basic protections mentioned by Dr. Andrea earlier are in place and that the circumstances allow for them to safely come to an end. I don't want to wear a mask, but until it's safe to take it off, in settings with a lot of people, in situations with a lot of people, I'll continue to wear one. We have to do that for keeping each other safe, and that shouldn't be downloaded through individual responsibilization. The government needs to leave the mandate in place. Thank you.
Thank you so much, everyone who spoke today and who joined in on this press conference live. We are going to be re-uploading this with captions. We had a bit of tech issues this morning, and we're going to be opening the floor for questions both through Facebook and through Twitter if people have any. We just want to reiterate that, the egregious death tolls across the province have particularly impacted disabled people, and that's why we're here today. All of our organizations, the Disability Justice Network of Ontario, the GTA Disability Coalition, the ODSP Action Coalition, Doctors for Justice in Long-Term Care, and the Criminalization and Punishment Education Project, as well as Horizon Ottawa, are demanding increased access to testing, PCR tests and rapid tests, proper access to vaccinations, upgraded vaccine passports, ventilation upgrades, and a real plan to solve the healthcare and staffing crisis, as well as increase hospital capacity and 10 paid sick days for all workers who contract COVID-19, on top of keeping the mask mandate in place so that everyone in our healthcare systems, in our prison systems, in our schools can roam freely without further fear of contracting COVID. And we know that keeping the mask mandate in place isn't the solution to all of the issues around the pandemic, but getting rid of the mask mandate makes it a lot likelier that many people who are immunocompromised, who are disabled, who are already struggling to access healthcare because of policies like the Ontario Triage Protocol that literally says on paper that disabled people will receive less care in high capacity situations in our hospital simply for being disabled. We can't continue to take away the measures of safety that exist for disabled people and then say that we are worth less care in our hospitals on top of privatizing our hospitals without naming this for what it is. It's modern day eugenics. Our government has decided that some lives matter over others. And like I said earlier, any one of us can be disabled at any point in time. And so what we're saying is that if you're not seen as being able to be productive, or you're not seen as valuable in our communities, you are going to be thrown away. You're on your own. You can die. You are at higher risk of death, and it's your problem to deal with. And we do not believe that this is right. And we think the Ford government needs to be doing better and needs to be doing more. The government must do all that they can to prevent needless death and debilitation, or our collective neglect will kill people. It will kill disabled people. At this point, we will open the floor for questions. So I see a question from Katie Babcock here in Hamilton. Is there a way to hold the government accountable through the law? Sam, I feel like you talked about this through Horizon Ottawa. Do you want to take this question?
Yeah, sure. I can briefly mention. Excuse me. I mean, certainly one way to hold the government accountable is in the upcoming election coming up soon, provincial election and then the municipal election. But one thing that us at Horizon Ottawa have been doing here is trying to push our city council and our medical officer of health, our local medical officer of health, to enact their own measures, because under Section 2 of the Health Protection and Promotion Act, they have sweeping powers to do that. So, what we've done here is we've set up a campaign to try and push them to do that. Is it for sure that they will? Not necessarily, but our sort of idea here is that failing the Ford government to act, which it's likely that they will not. That's another avenue to go towards, and we were already seeing some. Not our medical officer of health here; she has been very steadfast, unfortunately, so far in terms of following the moves of the provincial government. But some chief medical officers of health have already hinted that they might use the Section 22 order, like I mentioned earlier in Niagara, and I saw another one in an Eastern Ontario health unit. So I would say that yes, we can continue to push the provincial government, especially during this next election. But I would say also reach out to your friends and try and get them to push the your local public health unit and chief medical officer of health to enact policies, because they can enact policies and they don't need the provincial government to do it.
Question. We'll give it like a minute or two to see if any other questions come in from the public or press, and if not, we will wrap up.
So while we wait for some more questions, I thought I'd share a resource for people who are asking about legal action against this legislated genocide, this legislated eugenics ableism genocide. There's a really great resource called Arch Disability Law, who you can consult. There is precedent in Ontario already of taking legal cases against the government already for other matters, including the ableist policies of renewing health cards. And so it's not unheard of. There is precedent. And, you know, at some point, I think in our shared humanity, people who are making policies and governance need to also understand that not only are they culpable and complicit in death and debilitation and permanent disability, which can be seen as assault, criminal. They're also potentially opening themselves up to the International Criminal Court. Countries across the world, including Canada, in regards to the ongoing colonial violence that Indigenous peoples in Turtle Island in Canada have been experiencing. These measures have begun, and so there is a way to prevent getting it to that in regards to this pandemic by doing the right thing and prioritizing the highest risk. Because when you prioritize the highest risk, you actually make everyone safer and you end this pandemic faster.
Thank you so much for adding to that. I don't see any questions coming in other than the one that we answered. So at this point, we are going to wrap up. But if folks do want to get in touch with, in terms of questions from the press, you can email info@djno.ca. If you're wanting to get in touch with any of the other organizations who spoke today, we will also be able to connect you. Please, please, please keep in contact with us. This is just the beginning as we head into a provincial election, and these are issues that we need to be fighting more often. Thank you.